The global theme of the 2022 World AIDS Day is Equalize. In country, however, this has been tweaked to highlight the importance of equal access to HIV treatment and prevention services. Hence, the theme Equalize to End AIDS, Access to Treatment and Prevention Services. Hello, you're watching The Last Mile with NACA, and I am Adesuwa Osuyi. This episode brings you sights and sounds of numerous activities held to mark the 2022 World AIDS Day. Take a look.
On the 1st of December every year is the World AIDS Day commemoration, aimed at creating awareness of HIV and AIDS and issues around its treatment and prevention, as well as to remember those who have died from AIDS-related illnesses. The global theme for the year 2022 is Equalize. However, as a call to action for increased availability, quality and suitability of HIV services, devoid of inequalities, the national theme is Equalize to End AIDS, Equal Access to Treatment and Prevention Services. As is tradition, there were several programmatic activities organized by the National Agency for the Control of AIDS, NACA, and partners in the days leading to the World AIDS Day, starting with a press conference at NACA Headquarters Building, Abuja.
This year's global theme for the World AIDS Day is to equalize. And our national theme is Equalize to End AIDS. This year's World AIDS Day seeks to promote equal access across population groups that are marginalized and vulnerable, key affected population groups, by removing economic, social, cultural, legal barriers to HIV prevention services as well as treatment across this group.
Equalizing in the context of Nigeria and in many other countries will mean we do everything possible to reduce our dependency on external resources to fund our program. Very simply, it will mean, so that we take away users' fees, which are still an impediment to access to services. It means we should increase our contribution, to funding health. Equalizing while acknowledging the role of the government also means we should put the community at the center of our response.
The theme is clearly a call for action, a call for a renewed commitment to achieve epidemic control and further actions towards ending AIDS by 2030. In Nigeria, we're moving closer and closer to our targets. We're certainly proud of the achievements we have made, working together with our partners. Having come this far, we must all now work together to address the inequalities which pose a barrier to ending the epidemic. Let's all work together to equalize.
Other days featured the Jumat at the National Mosque.
Every year, December 1 is the World AIDS Day. And this day is set aside for us to take a stock and look at what we have achieved in controlling it globally and what are the challenges and how do we address the challenges in the years ahead. But part of it is to pray for the repose soul of those that have departed and those that are suffering with the disease, and also to pray for our leaders to give us the political support and the courage to continue to fight HIV until the epidemic no longer poses threat to health, security, and well-being of our citizens.
And Thanksgiving service at the Praise Church Radio House Chapel.
So we've just come to create more awareness and knowledge in the church and to get people to join hands together to make sure that we tackle all the inequalities that is stopping us from ending AIDS by 2030. Those inequalities are resolved around issues that are economic, issues that are social, issues that are legal. So the church also should join hands with the larger society to ensure that we focus to end AIDS by 2030.
After which, officials of NACA carried out HIV testing and counseling services.
Much work has been done in the fight against HIV/AIDS in Nigeria. However, more work needs to be done. Together, we can end AIDS by the year 2030, even amidst coronavirus pandemic.
Educate yourself. This is crucial in the fight against HIV and AIDS.
Get tested. The only way to know for certain your status and stop the spread.
Get involved. People with HIV and AIDS need care and support.
Say no to stigma. Stigma prevents people from getting tested and those living with HIV from treatment.
Spread the word. The more we educate others about the disease, the better we can fight it.
Adhere to COVID-19 prevention protocols, wear a face mask, and maintain physical distance in public places.
Remember, only united can we defeat HIV to finish and end AIDS by the year 2030. Get tested today. Let's fight HIV to finish in Nigeria. What we want people to know is that there is an act against HIV stigma and discrimination. And the act has two components. There is the jail component, there is the fine component of it. So it can be both, actually, depending on the gravity. People with HIV live normal life. They work as productive as any member of the community. And among them are intelligent people, hardworking people. Why should we discriminate against them? If we stigmatize people and we discriminate, it puts them away from our hospitals. It prevents them from coming to our facility to know their status. It prevents them from coming to our facilities to take these medications that are very helpful. So stigma is a number one enemy for us in fighting HIV disease and in controlling HIV disease. And we will be all out against it.
There were also sporting activities and roadshow.
So in remembrance, commemoration of our fallen heroes, and in celebration of our achievements, so far, so good, for a solid 2 decades, I'm here declaring our road show today open.
Can we join our hands together, please?
Thank you.
Gender and rights dimensions in HIV testing and treatment uptake. The Nigerian context was the topic at the technical session and panel discussion event held another day. There were dialogues for adolescents and young people, organized by NACA as a platform to reach the youths and other affected populations.
Like this now, take am easy now.
Now hospital I dey go to do HIV test.
Now everything you they do HIV test. Before you carry belle, you do HIV test. Now you dey rush go do another HIV test. What you dey find, you go see am o.
No be so, my sister. HIV test no be bad thing o. Now make I know my status so that no matter the result, my pikin no go get HIV.
HIV fit pass from mama to pikin?
Yes, so during pregnancy or labor or even when we dey breastfeed the pikin. Yes, and my husband dey road dey come sef, he go meet me for hospital. We go do the test together.
Hey, your husband na man he be. But wait oh, una no dey fear. What if the result come out positive?
Fear wetin na? HIV no be death sentence. And medicine don dey to take manage am. See, nowadays people wey get HIV, they live their life normal like everybody else.
You sure say I no go follow you go do my own so?
Wetin you dey wait for now? Come make we go jare. With quick action, we fit stop this HIV waka from mama to pikin. Go do your own HIV test today.
Finally, officials of NACA, relevant ministries, departments and agencies, implementing partners, civil society and community-based organizations, among other stakeholders, were gathered for the flag-off ceremony of 2022 World AIDS Day celebration. The Director General, NACA, Dr. Gambo Aliyu, delivered the opening remarks.
The Equalize slogan is a call to action. It is a prompt urging each of us to address the inequalities holding back progress in ending AIDS. We need to increase availability, quality, and sustainability of services for treatment, testing, prevention, so that everyone is served. Economic, social, cultural, and legal barriers still prevent marginalized population from accessing services. Inequalities, in whatever form and shape, must be addressed if we are indeed on our march to end AIDS by the year 2030.
Speaking further, Dr. Aliyu reiterated government's commitment to achieving epidemic control.
With about 90% of people living with HIV already identified and currently on treatment, we have recorded significant growth in key population treatment sites. From 10 sites in 2017, covering about 16,000 people living with HIV/AIDS then, to about 120 sites in 2021, with coverage of over 222,000 individuals. Kindly recall that the President of the Federation, Muhammadu Buhari, launched the 62 billion HIV Trust Fund of Nigeria in February this year. Today, we shall witness the launch of online donation portal of the fund to ensure no one is left behind in our collective effort to end AIDS by the year 2030.
The first round of goodwill messages were by representatives of the network of people living with HIV and AIDS in Nigeria, United Nations system and United States government.
The U.S. government's theme for World AIDS Day this year is putting ourselves to the test, achieving equity to end HIV. So when I reflect upon how this theme applies to Nigeria, it's clear that the over 1.9 million lives saved today, it's a tangible reminder of our enduring commitment to reach disproportionately affected and often marginalized populations. As we highlight the issue of equity, I congratulate Nigeria for demonstrating a renewed focus on reaching populations such as children, adolescents, men that have been left behind. Nigeria's ability to reach and sustain HIV epidemic control would be compromised if we were silent to the real issues faced by key populations, but also adolescent girls, young people, and communities that are isolated from quality healthcare services due to geography or insecurity. And this year's theme is a call for all of us to be inclusive and to guarantee that no one is denied equal opportunities or access to healthcare. The U.S. government remains committed to working with all our Nigerian partners to achieve equity as we work towards ending HIV as a public health issue.
UNAIDS published a report entitled Dangerous Inequality. In a nutshell, while we do recognize progress that has been made in the response, the report underlined the fact that we're not on track to end AIDS by 2030. But the good news is, if we equalize by ending those inequalities, we can end AIDS. The entire UN system in Nigeria stands in solidarity, ready to support the government in such a way that we can equalize and end AIDS by 2030.
As people, we are most grateful, and I would like to mention UNAIDS for providing their technical support to government of Nigeria and the entire communities. This cut across marginalized communities and people living with HIV. PEPFAR and other development partners, we appreciate you and will continue to appreciate what you are doing. Nigeria is one, and we are people of Nigeria, and we are working towards ownership and sustainability. If that is the case, we must work together.
There were also goodwill messages by the Secretary to the Government of the Federation, Minister of Health and NACA Board Chairman.
Three main issues: economic, social, and legal. As a lawyer, I know the importance of the legal side. When people are discriminated against, they hide. They don't want to come out again to say, this is what is going on in my body. And we need everybody to come on board so that we can take care of this virus better before 2030, not to wait for 2030. This is why we are calling on everyone, both here and all over the country, to be involved in this effort to put this virus behind us the next 8 years.
We are pleased with the landmark achievements we have made in our response to the epidemic in the past few years, which have taken us closer to the UNAIDS target of 95. It is important to keep up the current momentum. So we must continue to work together to address barriers arising from various circumstances that still impede progress. In this regard, providing HIV/AIDS services to reach, to test, and to treat HIV-positive pregnant women, children, key populations and their friends, as well as those in closed settings, particularly custodial settings. We must continue to seek programs and ways to facilitate access for this segment of our population.
The achievements mentioned above are heartwarming, but HIV still remains an unfinished business if barriers that pose a threat to ending AIDS by 2030 are not tackled headlong. I therefore urge everyone gathered here today to do all that is necessary to ensure equal access to HIV prevention, treatment, care, and support services, devoid of stigma, for children, adolescents, and key populations who have been left behind. I also wish to use this opportunity to urge all state houses of assembly who are yet to pass the anti-discrimination bill for people living with HIV to speedily do so without further delay. I kindly appeal to state governors to abolish the payment of user fees that will limit access to pregnant women to antenatal services during pregnancy. I would like to conclude by reassuring all of us gathered here today that Nigeria is focused on ending AIDS by 2030, and we join the global community to affirm that we can end AIDS if we end the inequalities which perpetuate this.
The Managing Director of the HIV Trust Fund of Nigeria, Dr. Jeku Ozoemena, then gave an insight on the current state of the fund including the new online donation portal. Highlight of the event was the signing of the Sustainability Agreement for Taraba and Abia states, unveiling of the National Strategic Documents, and launch of the HIV Trust Fund online donation portal. Commemorating World AIDS Day remains crucial as it serves as a clarion call to the fact that the fight against HIV is yet to be won. There is still a critical need for continued funding, increased awareness, improved education, and fight stigma and discrimination, among other competing issues.
We light this candle in memory of our colleagues, loved ones, friends that have died in the course of this pandemic called HIV in Nigeria, in Africa, and all over the world. We pray that the soul of all the departed rest in the bosom of the Lord. Amen.
This HIV self-test kit has been certified safe and effective by the WHO, Federal Ministry of Health, and NACA. For more inquiries, call the NACA Information Center free of charge on 6222. Do not eat, drink, or use mouth-cleaning products 30 minutes before the test. Find somewhere private with good light and a flat surface. The kit includes instruction leaflets that should be read carefully, a test stand, and a sealed package containing a test device, developer tube, and preservative used for storage only. This is not needed for the test. Open the test tube and place it in the test stand. Grab the test device by the handle. Do not touch the flat pad. Apply moderate pressure while swabbing the flat pad once along your upper gum and once along the lower gum. Immediately put the test device in the developer tube. Leave it there for 20 minutes before reading the result. Do not read the result after 40 minutes. Test is positive if both control and test lines appear, in which case you should contact NACA Information Center as soon as possible for advice on the next step. Test is negative if only control line appears. Test is invalid if there are no lines or only test line appear, or the white result background becomes red and should be repeated. Properly dispose all contents in the normal trash. Support NACA and the fight against HIV. Know your HIV status today.
For more information on HIV and AIDS and related diseases, or to report suspected cases of stigma and discrimination, violence and human rights violation, please call the National Call Center toll-free on 6222. Reach us via social media at National Call Center or email callcenter@naca.gov.ng and visit our website on naca.gov.ng. And that's our package with a simple message. If we equalize to end stigma and discrimination, we will end AIDS by 2030. Follow us on our social media platforms at NACA Nigeria and subscribe to NACA TV on YouTube for more. Till next week on The Last Mile with NACA, know your status and take action. I am Adesuwa Osuyi. Thank you for watching.